Okay, today, so we are starting your fundamentals of assisting part of your course. You do have a test over this material, and you do not have a textbook or a chapter that this comes from. All of the material for that test comes from this lecture. So feel free to pause the video as you go and take notes if you need to. I would highly recommend that you do. You also have a row assignment that has some questions, and I made sure I covered all of the row assignment questions in this video as well, so that you are fully empowered to do what you need to do. Okay, so prior to taking any vital signs on a patient, you want to perform hand hygiene and wash your hands. I'm going to step back a minute. Students will say, why do I need to learn this? This isn't what I want to do. Fair statement. However, the more you know, the more you're willing to do when the office is shorthanded or someone calls in sick or quits without notice, the more valuable you are to your office. The more valuable you are, the more you get paid. So embrace learning new things, even if you don't want to do that every day in your office. I can run the back office of my doctor's office. I don't want to. I can. I get really tired. I have a lot of feet problems, and 8 hours on my feet is really painful for me. But when somebody has a vacation day and there's nobody else to fill in, what are we supposed to do? And so jump in, pitch in, and guess what? They'll remember that next time that there's raises to be processed. So embrace learning it. Okay, so hand hygiene. In my doctor's office, we wash them right in the treatment room with the patient, and they see you wash it, and you don't even touch a doorknob once you've washed your hands. Introduce yourself to the patient, confirm the identity of your patient, name and date of birth, explain to them what you're doing. Not step by step. You're not teaching them how to do it, but I'm going to take your pulse now. I'm going to take your temperature. Can you open your mouth for me? Okay. Document your findings completely and be sure to author, sign and date, author your documentation. We need to know who did it. And it could be paper or it could be an electronic medical record, depending on how the office runs. So things that influence the temperature. There are certain things that can make a temperature go up. Bacterial infection, increased physical activity, food intake, being outside in the hot, being pregnant. There are certain drugs that increase your metabolism, stress, severe emotional reactions, and age. Infants have a little bit of a higher temperature than adults do. That's normal. Okay. So as we eat and our body is digesting, our body is working, that creates heat. If you go work out, it creates heat. So what brings your temperature down is the opposite. Viral infections, decreased muscular activity, fasting, depression, exposure to cold, being out in a snowstorm, drugs that decrease your metabolic activities, and being an older age is going to bring your temperatures down. So with those two things that I've just said, when do you think the patient's temperature is going to be the lowest? When has a person been the least active? When we sleep, right? And guess what? We also don't eat. So we've been fasting overnight. We were laying in bed overnight, maybe a little movement, tossing and turning. So the common sense, your temperature is going to be the lowest in the morning. And then as we move throughout our day, doing whatever we need to do, we eat, then we eat again, and we have soda or caffeine or coffee throughout the day. Our body is metabolizing, and all of that creates heat. So our temperature is going to be higher later in the day. So there is no normal temperature because there are so many factors. We have average temperature. So average for an adult is 98.6 Fahrenheit or 37.0 Celsius. Yes, you need to know both of those numbers. So prior to taking temperature, you should ask your patient if they have eaten, drank, or smoked in the last 15 minutes. Because what do you think the environment of the mouth is if I just had hot coffee or I just had an ice cream shake? It's going to be an abnormal reading. Also, Menthol cigarettes can affect heat. Smoking in general can affect heat inside the mouth. So if our patient has eaten, drank, smoked in the last 15 minutes, just wait 15 minutes before you take their temperature. Take their other vital signs and come back to temperature. Lots of places you can take temperature, and I have an error on here. Just going to cross that out. We'll get to it. Oral is in the mouth. You put it under the tongue, to the side in the heat pocket. In a doctor's office, oftentimes they'll put a plastic sheath for cleanliness over top of that thermometer that can be disposed of, and that's how you'll do it in the classroom as well. Oral, AU, temperature is your ear, also called tympanic, because tympanic means eardrum. You're going to make it a nice seal in the ear, and it's going to read a degree lower than what is true temperature. You will have an impacted reading if they have earwax or an ear infection. So if our patient's there for an ear infection, don't take their temperature in their ear. You'll get a bad reading, and you won't even know it. Axillary is the armpit. You need a good seal around it, so they got to kind of squeeze. It's also going to read 1 degree lower, that's typo, than true temperature. And you always document where the temperature was measured, because if it is one of these areas that has a lower reading than normal, we need to know that. I didn't put it on this slide, but anal temperatures, which typically only do with little babies, is 1 degree higher than true temperature. But a lot of babies, they don't do it that way anymore. They just do a forehead scan or an eardrum. But if they do it that way, you should know that. Okay. Blood pressure, sphygmomanometer. Sphygmomanometer is med term, means measure pulse and pressure. You need to make sure that you are selecting the proper cuff. So when you're looking at your blood pressure cuff, the one I have here says adult size. We have large adult for people who have larger arms, and we have pediatric size because obviously children have smaller arms, but we have a lot of students who are smaller and have very thin arms and need the pediatric size. When you put that cuff around the patient's arm, we have this range here that when the Velcro comes together, you need to be in that range. If you are either side outside of that, you need a different size cuff. Don't try and just, oh, it's close enough. No, it's not. And the screen is why. A cuff that's too small will give you an artificially high reading, and a cuff that's too large will get an artificially low reading. Okay. You need to know those. Blood pressure is measured over the brachial artery, which is this one right here in your arm. Brachio means arm in med term. The stethoscope is placed right above the antecubital space. Antecubital is your elbow bend, so right above it. Okay. If a blood pressure needs to be retaken, you only have to wait a few moments, like 20 seconds. You don't even need that long. If we were in the classroom and you were taking my blood pressure and you had to do it twice, that's fine, no big deal. But if you needed to do it a third time, I would personally ask you to change arms because my arm probably hurts at that point. So just keep in mind that if you do have to take it a third time, whether it's a classmate or your teacher or a patient, that you should probably offer at the third reading to change arms. If they say it's fine, then it's fine. But give them the choice, because a lot of people won't speak up. They'll just endure the pain and be annoyed and not say a word. So ask them. Be proactive in that. Okay. Blood pressure is recorded like this, 120/80. There's two numbers with a slash in between. The first number is the systolic reading, and the second number is the diastolic reading. The first number will always be the larger number. The systolic is measuring the pressure inside an artery while it's beating. That is the strongest pressure, is when the beat is happening. That's the maximum pressure. The diastolic is measuring the resting period between beats, and so that's the lowest pressure in that artery. So we need to know the highest and the lowest to measure health on a patient, because our arteries can only handle so much of a pressure, and then it's a problem. Okay, and that's what hypertension is the pressure's too high. Here's your normals. You do need to know the adult normal. 120/80 is textbook normal. Your pre-hypertension is when they're in that 120 to 139 range, 80 to 89 range, and high blood pressure is when it's above 140. We could also call that hypertension. So if I gave you a multiple choice question and I gave you 4 sets of blood pressure readings and I asked you which one is normal, it may not be exactly 120/80. You need to recognize that 118/72 is normal as well, okay? So you need to be able to realize there's some ranges there. But if I gave you one that's like 130/90, that's definitely not normal. 100/65, I didn't ask you, a child's normal. That would be too low. So you need to be able to recognize normal, pre-hypertension, and high blood pressure. You do not need to memorize your child or adolescent one. With your blood pressure cuff, it's a real skill to learn how to pump it up and control the release of the air so that it's not too slow, because that can hurt your patient, and not too fast, because if it's too fast, you won't be able to read your reading on your meter. So it's a real skill. You'll practice that in the classroom. Okay, pulse. Pulse and heart rate are typically the same thing. Common sites for pulse is the radial, carotid, temporal, brachial, femoral, popliteal, and dorsalis pedis. So with that, I'm going to say it in other terms. Wrist, neck, temple, arm, femoral is like in the groin, popliteal is behind the kneecap on the backside, and dorsalis pedis is down in the ankle. We also have the apical pulse, which is here at the heart, the apex of the heart, but you need to do that with a stethoscope. You wouldn't do that with your fingers. So find your own pulse. This is the radius bone on the thumb side of the arm, and that's why they call this the radial pulse. So you're going to go center of the wrist and then towards the thumb side. Don't use your thumb. You have a pulse in your thumb. Use your fingers, 1 or 2, and find your own pulse. You got to palpate. Palpate means to push around, feel for it. Press firmly. You're not going to hurt your patient. You can press kind of hard. Find your own. So as we get into how to do this, do your own. Find your own. And then guess what? Practice on everybody in your life. Your kid, your mom, your brother, your sister, your husband, your wife, your best friend. Practice on everybody you can get your hands on. Literally, get your hands on. Okay. Then you want to document that. Most offices, you're going to count that by 30 seconds and multiply the number by 2 to record your documentation. Although some offices will ask you to do it for the whole 60 seconds of a minute. You also want to document not only the number, but also where you took it. Radial, carotid, temporal, where'd you do it? And you should also record the quality and characteristics such as weak, rapid, slow, strong, etc. Students will ask me, well, if I know how to do it here, why don't I just always do it there? Why do I need to know these other locations? Well, what if I'm a paraplegic and I have no sensation? It's probably not a good idea to take the pulse in an arm with no sensation. What if I just had a trauma? What if I just amputated my arm? Or what if it's like bleeding all over the place? You probably shouldn't do that arm. Okay, kind of common sense. Well, what if I don't have arms on either side that you can use? Maybe it's a severe trauma and I've got car accident and I got bones sticking out or something. You can't use my arms at all. You've got to go to a second place. Okay. Another thing that you would need to know more than one location is if my pulse is great here and my pulse is great when you listen to it with a stethoscope here, but you think I have a blood clot, you can take my pulse all the way down to my ankle and they should all be the same within a number or 2. Well, what if I have that blood clot and my ankle is 30 beats lower? That's a clear sign of a problem. So you need to know more than one place. Doctors and nurses do it all the time. What is normal? Again, you only need to memorize your adult normal, 60 to 80 beats per minute. That is a normal activity. If you are exercising, working out, aerobics, that of course is going to be higher until your body cools back down again. You can see the numbers way, way higher for little ones, but you don't have to memorize those. Respirations. How many times do you breathe in and out per minute? So you count for 30 seconds, again, multiply by 2 in your documentation. Respiration is normally 16 to 20 per minute. That's going to go down as you get older. I know in those last days of my father's life, I swear, breathe 4 times a minute. So it goes down as you are ill. And it's much higher when you're little. You can see 44 a minute for a newborn. That's like double. That's crazy high. Okay. Height. We need to make sure shoes and hat are off. We're going to set the coat and purse aside. I always put down a clean paper towel because the patient is standing on it in their socks or bare feet. Typically, there's 2 measurement bars. I'll show you a close-up on the next screen. Normally, the larger one is either 20 or 50 pounds, depending on your scale. And the lower one, or the other one, is for 1/4 pound at an increment. So here's a larger one. So this scale, I'm going to assume, is more of a pediatric scale, seeing as how the bottom one only goes up to 140. You could not weigh me on this scale. I weigh more than that. So you would do the bottom one until you get out far enough, and then do the top one to catch the extra pounds. And then you would add the 2 numbers together. So if we bring this one over to here and this one to here, we add them together. That patient is 89 pounds. When you're taking weight of a patient, or your instructor or a classmate, when you go to do your hands-on skills, when you're done, always make sure you put the scale back to 0. Most people don't like getting on a scale, let alone to have their weight being advertised to the whole classroom after they get off. So be thankful you guys aren't in full class, because normally students don't want to get on the scale in front of other people. But believe me, nobody's watching, except for the one person who's doing your weight. Okay, height, we should be facing outward. Again, we want to make sure we have shoes off. You want to bring the bar down to rest on the skull. Sometimes you have to push through the poof of their hair. If they've got curly hair, they got a bun on their head or braids or something. Sometimes you got to try to get it all the way down so that you're not measuring that hair as extra height. You do need to memorize your inches to feet. Most scales only give you a number like this, and 74 inches is what? Well, most people, adults, are in the 5-foot range. So if you just memorize that 60 inches is 5 feet, well, if you hit the 6 foot, that's going to be 72 inches. So if this comes down as 65 inches, that's 5'5". 68 is 5'8". So a lot of those that range in the 60s are pretty easy to do. It's when you hit the 70s, you got to remember that you're not to 6 feet until you hit 72 inches. So 71 inches is 5'11". But it'll come the more you do it. You may, for your homework, I don't know if they took this assignment off or not, or this question off, that you might need to know how to convert inches to centimeters or pounds to kilograms. So there's your conversions. I just pulled them up on Google. So if you don't write this down now, pardon my typo there. You can always just Google it. Converting inches to centimeters, and it'll come right up. And honestly, when it comes right up, you can actually type your inches in. So if I tell you convert 65 inches to centimeters, you can just have Google do it for you. Or a calculator. No one's asking you to do it without a calculator. Okay. I want to show you a few other things here in your Canvas before we wrap up. In your Canvas, under sessions 21 and 24. You've got some videos and activities that you need to do before you come into class to do your hands-on skills. Your instructor, when you go in to do your hands-on skills, is not there to teach you the whole thing. You should already know the theory when you go in that day. So I know with my students, the first thing I'm going to say is, explain to me how to take a height. You watch the activity, yes? And they're going to go, yeah, because even if they didn't, they're going to tell me yes. Then I'm going to say, okay, explain to me some of the things about taking somebody's height. And if they look at me with a blank face, I'm going to tell them to go over to their Canvas and do this activity. They should be able to tell me what they learned from these activities. So feel free to take some notes so you can review before you go in that day. These are hands-on activities: height, blood pressure, and weight. Those are the only 3 you have. However, this is a great video, and then down here under 24, you have another video. So watch those so that you are prepared for Skills Day. Another thing that you might want to look at is down here under session 30. This is your proficiency sheet. This is the document that I will be grading from. This is the Ross guidance of what we're looking for. So you can look at it. There's no secret there. And it looks like this. So it tells me here for height and weight, this is what I'm looking for. This. Did you do all these things? Okay. Pass or fail. And you can have multiple times. There's only first, second, third attempt on here. If you need 10 attempts, that's okay. Oral and tympanic temperature, so mouth and ear. Radial pulse and respiration. So the only pulse we're going to have you test is this one. Although I probably will have the students listen to their heartbeat with a stethoscope just because I think it's a good skill, but it's not something that, you know, they have to master or something like that. And then do a blood pressure. I do want to talk a little bit about stethoscopes that you have in the classroom. Your stethoscope, the bell, this piece, actually has 2 sides to it, a large side and a smaller side. You can use either side to listen. If you can't hear it very well with one side, flip it over, try again. But this twists just a little bit, but you will hear it click. Not all stethoscopes do this, but the one I have in my hand does. So check yours when you use it. And the reason I'm showing you is this is the on and off. So if I have this in my ear and it doesn't seem to be working, it's probably off. I've had students go, this stethoscope doesn't work, it's broken. And I'm like, is it on? And they're like, oh, forgot about that. And they give it a little twist and go, oh, yeah, it's on. I just didn't have it on. You don't want to walk around with this in your ears. People think it's funny to pick up a stethoscope that's hanging from you and say things into it really loud, and that could blow your eardrums. So when you are not actually listening to a heart, get it out of your ears. In the classroom, we have the alcohol wipes to clean it, and you should also clean the bell side before putting it on your patient. Another thing that we have in the classroom when it comes to doing your blood pressures is we have 2-headed stethoscopes, meaning that I can put a set on and you have a set on and there's only one bell. So our tubes run to the same bell. That means you and I are hearing the same thing. That's how we're going to test you, is we're going to be listening with you and measuring with you. And so when you do your hands-on skills, you do need to be fairly close to the number your instructor comes up with. Do I need you exact? No. If I think the blood pressure is 138 and you say 136, sounds good. You say 140, that sounds good. You're close. You're only like one little line off because the lines go by twos. But if you tell me it's 132 and I get 138, we're off too far. Guess what? You're just going to do it again. Okay, so don't stress. I've had plenty of students have to do it multiple times. Not to make you nervous or anything, but I've had students have to go to the bathroom and cry because they can't get it and get a little pep talk, and then they come back and nail it the very next time. I had a student once, she was so upset. She was in her second module, and she couldn't get it, and she's like, I'm just going to quit. And I'm like, you're going to quit the whole program over this one stinking blood pressure that you aren't probably ever going to do in your career? I said, no, you're not. We calmed her down. We found the easiest student in the room who had a really pounding blood pressure. She was pretty easy to hear. We did it on her. She was fine. She passed. So no, you can get this. You might go, I'm not going to like this. You don't have to like it. We learn lots of things we don't like. And we don't necessarily have to do this in our career, but it's a good knowledge to have in your back pocket. It makes you valuable to your office, especially if you're willing to jump in when they're shorthanded. And the staff, the office manager might go, you know how to do that? Go, yeah, I can do that. Of course, your doctor's offices, a lot of them have automated blood pressures. They just put the cuff on, hit the button. That's even easier, right? Anybody can do that. So good luck. Make sure that you schedule time with your campus. You will need more than one session. You're not going to be able to do all of this in one session. You're not necessarily going to do all of this the first time. I can certainly imagine that there might be a patient or a student or two that I have to send home with a blood pressure cuff and stethoscope and say, practice, and come back next week. Okay, practice on everybody you can get your hands on. Make them sit still and do blood pressures over and over and over again. I've even had students go, well, my mom's a nurse. She'll help me. Great. Great. Okay. So don't wait to the end of the module to do your skills because you may run out of time. So definitely get on the schedule soon and get going on this soon. Good luck.